Thanks so much for joining us today, Chief Michael Bust. I'm curious, what's your role in response to emergencies?
In the fire department here in Lewiston. So we are what we call an all hazards department. So we provide the fire responses, but we also provide all advanced life support and BLS life support, transport, EMS. So, and hazardous materials. So basically any type of emergency that's going on, our department is handling all of those calls.
And how has the recent surge in COVID cases affected your ability to respond in a timely manner?
Well, the COVID calls have definitely had a significant uptick over the last few weeks. And then you add that to the already current call volume. It's been a busy summer alone. And then you add the COVID to it. It's been really hard. We actually last month was the largest number on record in our department's history for the number of EMS calls in a month. And as we're finishing out this month, we anticipate we will break an all-time department record for the number of EMS calls. And we made up about a 10% deficit that we've lost over the last 5 years. We've made that up in the last 3 months.
When you're talking a deficit, you're talking about the number of calls you're responding to?
Yes, so we've taken the approach over the last few years of trying to educate the public of when to call 911 because we were getting called. And then when COVID originally started 18 months ago, our call volume dropped off drastically. And now we've seen the surge and we've made up all of those calls that we took away over the last 5 years. We've made those up and some within just a couple months.
How does that affect your response time?
It throws a challenge and it's requiring us to look at prioritizing it. And I say that it hasn't impacted us as much. And that's because of my staff. We call them the cruiser, what we call turn and burn. They go on a call, they get to the hospital, they drop the patient off, and then as soon as they can get the gurney made and get supplies, they're going to the next call, which then creates a big deficit on our report writing. But we are having to prioritize whether we're sending an engine company to a call or a chief officer or a medic crew utilizing mutual aid. And then that also then has impacts on a fire response because like your first question is, we go to all calls. And so if we're tied up on EMS, and what we're seeing what we call call concurrency. When we get one call, we're seeing 3 or 4 calls in the next 10 minutes. And so we're calling in off-duty personnel, and it becomes a very big challenge.
You're president of the Idaho Fire Chiefs Association. What are you hearing from other first responders around the state?
I just had a board meeting with all of our board of directors just before this interview, and the message is simple as every department is seeing a significant amount of call volume, which then is taxing their system. And then more importantly, is it's taxing our employees. I mean, that we've been dealing with COVID for 18 months, and now with this last Delta variant surge, they're just worn down. And of course, we've had coming off of a wildfire season of one we've never had before. And it is truly, we're really worried about them being worn out. But that's the message across the state is that we're just going on a lot of calls and everybody's having to prioritize their responses. And, what we don't want to do is, have to delay responses. But because of priority dispatching, we may take an alpha, a low acuity call, and we may have to wait 10 minutes and before we can get someone heading that way.
You've mentioned your employees a couple times, and you mentioned that they turn and burn. They turn around and they go right to the next call. Have they also had to deal with themselves being out and having to isolate or be in quarantine because of their own exposure?
Here in Lewiston, we've done well with we have standards of how we live in the fire stations and how we go on calls and taking all the protective means we can. But yeah, it has an impact. And then the bigger impact is those that are off in quarantine. We have to keep those staffing levels up. And so even this morning, I had a meeting with one of my battalion chiefs. We had to mandatorily require an employee that's having to work 16 hours of overtime today because we are short staffed and we have to keep the staffing. And we've had record numbers of overtime this year due to wildfires and calls. And so now they just finished a 24-hour shift. We're mandatorily making them work 16 hours. They're going to get an 8-hour break, and then they're going to come back tomorrow and finish another 24-hour shift. And with the call volume, I mean, we usually average 20 to 23 calls a day. We're popping 46 to 50 calls a day right now with the same staffing level. And that's what we worry about of those people. And that's what I'm hearing across the board with a lot of EMS agencies and fire departments in Idaho.
Are you or other first responding agencies losing staff to burnout?
We haven't yet, but that is one of the things that usually that takes a little while before we see that impact. But that is something we're doing. That's why I'm trying to be proactive as a chief and work with our staff and make sure that they're taking time off. And, like we had to mandatory overtime someone today, but we're going to make sure that if the next on their off shift, that person isn't going to be mandatory. So we're trying to do the best we can, but I think that's going to be one of the long-term impacts of this is people are going to realize, is this the career path that I want to go through this? What happens with the next pandemic or the next event? And they're just getting really tired.
We know that a number of patients in rural Idaho have to be transported to larger hospitals from critical access hospitals. What's your role in that, and what are you seeing?
So our role is we try to support our outlying rural access hospitals and bringing staff. But here recently, we've struggled because we use our off-duty fire and EMS personnel to take those transports. So we keep our on-duty crews for the 911 calls. And because of the workload and the call volume, if they get 8 hours off, they're not answering their phone. They're not coming in. And so that is having an impact to where we're having to say no more than we ever had before for these distance transports of bringing patients from the rural access hospitals in, or bringing from our patients because our hospitals are getting full. Is maybe that rural access hospital is the only hospital that has a bed that we can get a patient into. And so we're having to say no more than we ever have before. And I don't hold that against my personnel. They have to rest. I mean, we're all worn out, and that's just one of the impacts of what we're facing.
When a patient needs a bed and you aren't able to transport them, what happens to that patient?
It's an interesting deal because that bed, if the medical facility, it's kind of like a lottery. We get the bed, and if they can't get the patient transported or en route within a period of time, they may lose that bed completely, which then now that takes the medical facility having to go back through the process of calling and trying to find another place. And so that is one of the impacts that we are seeing. And then maybe that patient's stuck in the emergency room, which now, if we transport an emergency call in, they may have to wait in the waiting room for a few hours because, our emergency rooms that maybe have 20 beds. Well, if they're holding patients because there's no place in their facility or another, maybe now we're down to a 12 bed ER instead of 20. And that's an impact where motor vehicle accidents, we're seeing a lot of traumas right now in motor vehicle and illnesses that aren't COVID related. And so all this just kind of creates the perfect storm to where we see these critical patients of are we going to be able to get them the care they need in the time frame they need?
How about patients who need to move to hospitals that are even further away? What's LifeFlight's role in that?
Yeah, so usually if they're a farther distance, they're bringing in their fixed wing planes, and that creates another impact on us because we have to get the flight crew to the hospital and then the patient and the flight crew back to the airport. Those calls can take 45 minutes to an hour, and that takes one of our primary 911 ambulances out of service. So we're working with our mutual aid partners to try to see, okay, who has an available resource? Can we get them there? And, under the crisis care standards, it allows us to send a single provider on that vehicle because the LifeFlight crew is providing all the patient care. But we're getting creative. We're doing things in my 30-year career I've never seen before. And talk about, I always say I'm about thinking out of the box, but in the last 18 months, I've never thought more out of the box than we have, just to make sure we're continuing to provide the services our communities deserve.
I know you aren't in billing, but I have to imagine that sending a fixed wing aircraft to send a patient to Missoula or wherever they're going cannot be cheap. And then you have the cost of getting them home.
Yeah. Yeah, I think the long-term impact of all of this on our healthcare and our insurance system is going to be unknown for the next year or two, but I think we will see that there will be an impact from that because the cost of healthcare for these serious calls and those transports is significant. I can't imagine what the bill for a fixed wing flight to, Montana or Wyoming like we're seeing, but it can't be cheap.
What can people do right now to ease the strain on resources that first responders are experiencing?
Well, one of the things is we always want to make sure is that you're calling 911 when you need to call them. If you're calling to, well, I'm not sure what med or you know, what about my oxygen cylinder? We're trying to prioritize that. The other is the things of what can we do? Wear your seatbelt, wear your helmet, wear a life jacket. I mean, we're still in the weather. This weekend's going to be warm. People are going to be in the water. We see drownings. The fishing season is doing those preventative measures we can do for the emergencies that are going to continue to happen, whether we're in a pandemic or not. And then realizing, if you need an emergency, if you are truly having an emergency, please call us. The other is don't put off your health care. That's one of the things we're seeing is people are sicker because they've been putting off just going to the doctor. And yes, we're in a pandemic, but that has a big impact that then trickles down. And now we're putting a bigger load on our 911 services and we're delaying responses. And so if we can prevent that, I think that's the most important thing we can do here is just be proactive and follow those preventative measures that we've been talking about.
All right, Lewiston Fire Department Chief Travis Michaelbus, thank you so much for joining us today.
Thank you for having me on.